Ultimately, the decision to travel or to have an event or to have a large Thanksgiving feast is yours to make. But I want to make sure that you can't say you didn't have all the information and the knowledge that COVID-19 is a serious disease. It's led to millions of hospitalizations and hundreds of thousands of deaths worldwide. I realize that some people may still choose to travel. Maybe you need to travel. Sometimes you'll have to travel. And in those instances, we are trying to provide guidance to help accomplish this in as safe a manner as is possible, knowing that we could never fully mitigate all the risk. So consider how you're going to travel or your mode of transportation. Obviously, when you fly, there are security lines as you go through the airport terminals. Think about a flight with layovers where it may be cheaper, but obviously that will pose more risk than a direct flight. Traveling by bus or train versus taking your own vehicle. Obviously, taking your own vehicle, if that's an option, would be safer. Traveling by bus or train, you might not be able to maintain 6 feet of distance, and sometimes that will be for extended periods of time during the journey. If you are driving your own personal car, plan out how you will do the stops for gas, for food, for bathroom breaks. Think about hand sanitizer and washing your hands frequently. IDPH has issued travel guidance and created a travel advisory map on its website. This is to help you make more informed decisions about travel if you have the choice or if you can postpone, but you can look there to see what's going on around the world. This is available at www.dph.illinois.gov/travel. We all want to be with our friends and family for the holidays. But perhaps this holiday, as we have already done for most of 2020, we are going to have to do it COVID style, and that means virtual. We'll have to stay at home and forgo the large gatherings so that we will have future events that we can be with our friends and family. Today, we are reporting 9,935 new cases. These are not duplicates. These are not people who took 5 different tests. These are new individuals diagnosed with COVID for a total of 447,491 cases. And as the governor mentioned, that includes 97 newly reported deaths for a total of 10,030 lives lost. And not that the 97 is not enough, but that includes individuals in their 20s, 30s, 50s, as well as people in their 60s and over. 3,891 people were reported to be in the hospital overnight with COVID-19, and of those, 772 patients were in the ICU, and 343 patients were on ventilators. In the last 24 hours, 86,015 tests have been reported for a total of more than 8 million tests. So as always, let me close with wear your mask, please. Wash your hands, please. Watch your distance to other people. And if you haven't already, get your flu shot. We are really at the point where we are concerned that whether you have the flu, whether you have COVID, whether you have chest pain, whether you have stroke-like symptoms, we are worried that there won't be a bed enough for everyone. So let's make some decisions now to decrease from the nearly 10,000 cases today. We can do something about the future number of cases that are identified. Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.